Electroencephalogram EEG. The electroencephalogram EEG is a medical test used to measure the electrical activity of the brain. A number of electrodes are applied to your scalp. EEG can help diagnose a number of conditions including epilepsy, sleep disorders, and brain tumors. When an EEG is used, an EEG can be used to help diagnose and monitor a number of conditions affecting the brain. It may help identify the cause of certain symptoms such as seizures, fits, or memory problems, or find out more about a condition you have already been diagnosed with. The main use of an EEG is to detect and investigate epilepsy, a condition that causes repeated seizures. An EEG will help your doctor identify the type of epilepsy you have, what may be triggering your seizures, and how best to treat you. Less often, an EEG may be used to investigate other problems such as dementia, head injury and concussion, brain tumors, encephalitis, brain inflammation, sleep disorders such as sleep apnea. How an EEG is carried out? There are several different ways an EEG recording can be taken. The clinical neuropsychologist will explain the procedure to you and can answer any questions you have. You will also be asked whether you consent to treatment for the various parts of the test to be carried out. This may include video consent for some EEGs. Before the test starts, your scalp will be cleaned and about 20 small sensors called electrodes will be attached using a special glue or paste. These are connected by wires to an EEG recording machine. Routine EEG recordings usually take 20 to 40 minutes, although a typical appointment will last about an hour, including some preparation time at the beginning and some time at the end. Other types of EEG recording may take longer. There are 5 types of EEG graphs. First one is routine EEG. Second one, sleep EEG or sleep deprived EEG. Third one is ambulatory EEG. Fourth one is video telemetry, and fifth one is invasive EEG telemetry. Now we will briefly describe about types of EEG. Routine EEG. A routine EEG recording lasts for about 20 to 40 minutes. During the test, you will be asked to rest quietly. You will usually be asked to open or close your eyes for time to time. In most cases, you will also be asked to breathe in and out deeply, called hyperventilation, for a few minutes. A flashing light may also be used to see if this affects your brain activity. So next is sleep EEG or deprived EEG. A sleep EEG is carried out while you are asleep. It may be used if a routine EEG does not give enough information or to test for sleep disorders. In some cases, you may be asked to stay awake the night before the test to help ensure you can sleep while it's carried out. This is called a sleep deprived EEG. Ambulatory EEG. An ambulatory EEG is where brain activity is recorded throughout the day and night over a period of 1 or more days. The electrodes will be attached to a small portable EEG recorder that can be clipped onto your clothing. You can continue with most of your normal daily activities while the recording is being taken, although you will need to avoid getting the equipment wet. Video telemetry. Video telemetry, also called video EEG, is a special type of EEG where you are filmed while an EEG recording is taken. This can help provide more information about your brain activity. The test is usually carried out over a few days while staying in a purpose-built hospital suite. The EEG signals are transmitted wirelessly to a computer. The video is also recorded by the computer and kept under regular surveillance by trained staff. Purpose of video EEG monitoring test: diagnose recurrent epileptic episodes, locate the exact brain area where epilepsy begins, identify the types of seizures, determine the most beneficial treatment for patients with epileptic seizures. Invasive EEG telemetry. This EEG is not common, but it may be used to check if surgery is possible for some people with more complex epilepsy. It involves surgery to place electrodes directly on the brain to find out exactly where the seizures are coming from. Are there any risk or side effect? The EEG procedure is painless, comfortable and generally very safe. No electricity is put into your body while it's carried out. Apart from having messy hair and possibly feeling a bit tired, you normally will not experience any side effects. However, you may feel lightheaded and notice a tingling in your lips and fingers for a few minutes during the hyperventilation part of the test. Some people develop a mild rash while the electrodes were attached. If you have epilepsy, there's a very small risk you could have a seizure while the test is carried out, but you will be closely monitored and help will be on hand in case this happens. Preparing for an EG. There are some things you should do to prepare for EG. Don't eat or drink anything with caffeine for 8 hours before the test. Your doctor may give you instructions on how much to sleep if you are expected to sleep during the EG. Eat normally the night before and day of the procedure. Low blood sugar could mean abnormal results. Let your doctor know about any medications, both prescriptions and over the counter and supplements you are taking. Wash your hair the nights before the test. Don't use any leave-in conditioning or styling products afterwards. If you are wearing extensions that use glue, they should be removed. EEG results. Once the EEG results have been analyzed, they will be sent to your doctor, who will go over them with you. The EEG will look like a series of wavy lines. The lines will look different depending on whether you were awake or asleep during the test, but there is a normal pattern of brain activity for each state. If the normal pattern of brain waves have been interrupted, that could be a sign of epilepsy or another brain disorder. A normal EEG does not mean you do not have epilepsy. Your doctor will do other tests to confirm a diagnosis. Thank you so much for watching my EG video. If you have any questions about the video or would like to discuss any related topics, feel free to reach out. I would love to hear your thoughts. Thank you so much once again for watching.